Today I am going to help you mark with the pectoral region as it begins in the upper limb, and this is your first major region from the upper limb. First of all, from this page of BD, this knowledge is only for superficial reading. Nothing comes as like MCQs or Viva question or any kind of SCQ short essay question. This does not hold any important weightage. You just give a small read to this topic, like it shows it represents a bone called clavicle, jugular notch, sternal angle, and epigastric fossa. The landmarks like jugular notch, sternal angle, and epigastric fossa, these are important only and only in the thorax region. From here, you just give it a read, and you do it only for an MCQs view like jugular notch, sternal angle, and epigastric fossa. Don't give it a detailed read. Don't give it a detail as nothing comes out of it like MCQs. Okay. So next you have the next page of BD. It tells you superficial fascia. Now superficial fascia, this also does not have any kind of weightage, but you should know that the superficial, what is a superficial fascia? I'll give you a concept of superficial fascia. First of all, I have the skin on my hand, right? Skin. Beneath the skin comes a tissue which we call superficial fascia. Beneath the skin there is a fascia, a layer which is called superficial fascia, and then beneath the superficial fascia we have deep fascia, and then after the deep fascia, below the deep fascia, we have muscles present in our body. So this is the arrangement of the texture that I tell you. So superficial fascia, what I tell you is that, and that you just give it a read as nothing is important out of this topic. No MCQ, no SCQ. After the superficial fascia, you will go to the cutaneous nerves of pectoral region. Just give it a read. What are the cutaneous nerves, and just read their names. Look at this, like names of the cutaneous nerve: anterior lateral cutaneous nerve, costobrachial nerve. But this also does not hold any point weightage. Cutaneous vessel, just names of cutaneous vessel, read them for just MCQs, but they haven't asked in any kind of paper till now in UHS. Next are the platysma. What is a platysma? Now platysma is a question that was once asked in a past paper, and I will give you a voice note explanation of this. Next comes the breast. Breast is the main topic from the pectoral region, which I will have to study in detail. Breast, first of all, you will do the location of the breast. Breast is present in the pectoral region. Next you will do the characteristics of breast, which are written here. The breast is found in both sexes, rudimentary in male. This is the MCQ, rudimentary in male, well developed in female after puberty, provide nutrition to newborn, and all these points you read. Okay. Aage situation of breast is for Viva and as well as for SEQ. For situation you have to do the superficial fascia, where it is located, superficial fascia, what are its quadrants, and just like this. Okay. Next is extent of base. Extent of base is also important for MCQs, and you do it for MCQs. Next is deep relations. You have to name the deep relations. This is a SCQ, and you have to name the deep relations of the breast. Here we go to the structure of breast. For structure of breast, you will do the parts of breast. Okay. These include skin, parenchyma, and the stoma. Parenchyma, known as the mammary gland. Parenchyma is the main mammary gland. Skin is the outer surface, and stoma is within the ductus system of the gland. I will tell you its detail in a voice note too. In this figure, these figures are only for conceptual understanding, only for conceptual purposes, and this figure represents. And this figure will represent you all the extent of the pectoral region and breast. Next we go to the skin. You have to do the points of the skin, as the gross features can be asked either in Viva or can come out of MCQs. You do not have to memorize the line. Look, there is no point in memorizing it word by word. You just have to do it in major points, like it covers the gland, it is a covering. What is skin? It is a covering. A conical projection nipple is present center of the breast. It has 15 to 20 lactivorous duct, circular nipple, modified stat and sebaceous gland. It is rich in nerve supply. These points are more than enough. Look, I tell you a method for the first time, and for a few topics then you will get used to it. You will do only the major points. You will not memorize the whole text, only some points that you feel is a very good pick for examiner. The second is the skin around in the base of the nipple is the pigmented areola, tubercles of Montgomery, sebaceous gland, prevent from cracking during lactation. These points are the only points that are important from this paragraph, and this point is a very good MCQs of the prof. Below the areola lies the lactivorous sinus, where milk is stored, and nipple is devoid of hair, and there is no fat sub-adjacent to it. Next is parenchyma, mammary gland, compound tubular alveolar gland. This is the type of the gland, can be asked by MCQs. Secretes milk, no capsule, 15-20 lobes, cluster of alveoli, lactivorous duct, and lactivorous sinus. These are the points you will do from here. Next is stoma. From stoma, you will do the supporting framework. It is a fibrous stoma part, suspensory ligament of Cooper fatty stoma, main bulk of the gland. These are points that you have to do for to read or to memorize, because these are SEQs. The blood supply, nerve supply, very important question of this region in blood supply. You only and only have to do the name of the arteries that are supplied, that are coming to the breast to supply it. And when it comes to veins, same name of veins, only and only names. Nerve supply, you will do the name of the nerves involved, and this is an important MCQs. Autonomic fibers to MCQs comes like this. Hormone prolactin secretion is controlled by the hormone prolactin, but the secretion is not controlled by the nerves. This is the MCQs, and it is important MCQs. Next is lymphatic drainage. This is the most important university question that can be asked in the prof exam, and I also expect this to come in your block exam. Lymph nodes, very important concept of lymph node. I will give you a voice note of the concept of lymph node and share my handwritten stuff too regarding it. This diagram is now important to make too in the paper. You have to know how to make this diagram a bit easier, the way you like it. You don't have to memorize it. As I tell you, there is no pointing in doing each and everything. You just have to do it in points. So make a short view of this diagram, a short sketch that you feel it easy. Next we have this continues as the lymphatics of breast. I will provide you a voice note of this. Development of breast is not asked in the gross. In gross, you do the structure and study. Development of breast is something that is asked in embryology, but not in the gross region. So you don't have to do it. Just skip it. I tell you not to do it. Skip it. Next we have some clinical points here. Amestia and anthelia, you have to do this. Is a very important to be asked by examiner. Now histology of breast, nope, you don't have to do it. Histology will read in histology, not in the gross. Next come these pink boxes. Look, these pink boxes are very important, but I know a short method to do them. First you give a read to these pink boxes for MCQs, then you do the clinicals. This is the clinical anatomy. You will do the clinical anatomy from a combined PDF of all clinicals of upper limb that I share with you in the group. So you do it from there. Okay? Clinical anatomy you have to do from the clinical PDF, but you must read these pink boxes at least once for conceptual purpose. All these pink boxes for conceptual purposes, they hold very important SEQs, but when you memorize the clinical PDF of pectoral lesion, then you will do the SEQs from there. Like they asked, what is pude orange appears, what is the communication of the lymphatics of breast, and all these questions are very important to be asked. These diagrams are just for read, these diagrams are just to see, nothing important. Next we come to the pink boxes like these. These pink boxes are also just for clinical anatomy. You just do them, read them for MCQs. D fascia, I already told you what it is. It is below the superficial fascia. You don't have to memorize it. You just have to superficially read it, but nothing comes out of it as a MCQ or SCQ. So I will not tell you to do the detail of this topic. Just skip it. Next is the muscle of the pectoral region. Muscle of the pectoral region, you have to do the muscles from your Snell PDF. I will share you a PDF of Snell, and I will tell you how to do that muscle in a Zoom class in today's demo. So next we move to this. You just have to skip it. You also skip this. Clavipectoral fascia is important topic. I will share my handwritten notes with you, and I will also share the clavipectoral fascia in a voice note to explain you. This is only marking. This is not a lecture. Next we go to this page, serratus anterior organization. No, you don't have to do anything from here. Just skip it. Next is this also, you skip it, but you do the branch of the any artery nerve. Okay, no, skip it. This is important for MCQs. Just give it a read for MCQs. Next we go to other things. This was your pectoral lesion, and I will share you other stuff in the group 2.